And that is a really open-ended benefit that we want to offer. So there's no online reservations, as I mentioned. It's valid during all of our regular hours. There are no block dates, no limit on the number of visits that SNAP EBT cardholders can come. Children ages 4 and under are free, as they are for general admission, and they don't count against the 4-guest maximum for the SNAP EBT cardholders. And we have no plan to end this program as well, so it's available for the foreseeable future. We've done our best to spread the word to the intended audience in the Tri-County area, including in Monterey County. So for this group of folks who are watching today, just wanted to quickly summarize how we've reached out. We had a press release ahead of our launch. We've distributed information and printed materials to the Department of Social Services, and those have been distributed to the offices in Salinas, Seaside, and King City. We also distributed information and materials to public libraries throughout the county, and we have a website where people can learn more, and all of those printed materials include a QR code that takes folks straight to the website. All of these materials are bilingual in English and Spanish. And people have responded. More than 120,000 people have visited the aquarium through Museums for All since our launch on May 27th. That breaks down to an average of about 10,000 people per week, and they comprise about 15 to 20% of our total visitors since we've launched the program. I wanted to take the opportunity to mention some of our other access programs. We have a group visit program known as Free to Learn. And in that program, we work with nonprofit organizations, government agencies, and other social service providers to offer free access to groups that serve children, families, and individuals who might not otherwise be able to afford admission. I have a URL for that program. Folks do have to apply, organizations and agencies apply to become Free to Learn partners, and then attend an onboarding webinar just to understand the logistics of how we coordinate those group visits. We also have educational field trips for pre-K through grade 12 at public and private schools and for college classes. And here is a link to our field trip information if you'd like to know more about that. So I'll stop there and invite any questions you all might have.
Thank you so much for giving really a dive into how it all works. Those numbers are amazing. That the response to the program for people to come to the museum, to the aquarium, and as part of the museum program, it just, I mean, are you getting the feeling that this program is really dovetailing with the mission of the aquarium, which is to educate and inform and make people more aware of the science and marine life? It just all seems to fit in together.
Absolutely. That's why we're doing it. This is a mission-driven program. It's not a mandate. It's not something that is funded. It's something that we are including in our operations because, exactly as you said, we want everyone to be able to experience the wonder and the joy of the ocean, experience those educational benefits, and we hope eventually to feel like a part of the ocean conservation movement through their connection to these animals and the ocean.
You mentioned 120,000 people since the inception of starting to coordinate with this program. Do you get a sense of, is it families, is it children? I mean, when you walk around the aquarium, you're not going to know who's got an EBT card or not. So, everybody just looks happy and, in wonder of everything that they're seeing. But is there any data that you're seeing that more families are getting involved in this?
We do have data on the ages or the ticket types of people who are coming. I don't have that in front of me, but I'll be happy to get back to you. We also have optional zip code. We ask people, to voluntarily provide their zip code when they come in through the program. And so we're starting to see where people are coming from to visit. And we know that It's both out of county. We have a lot of people coming from Fresno and San Jose, Sacramento, and within the county, we have a lot of people coming from Salinas. So we're hopeful that a lot of these people have been wanting to visit the aquarium, and that the Museums for All program makes it possible for them to access this experience.
Well, and thank you for answering this next question that had come in. Where are people coming from? And it sounds like, well, the aquarium is known around the world. So to have somebody come from Fresno is not a surprise, but it is interesting that people are now able to look at a trip to the aquarium if finances hindered them, driving over, spending the day, just getting there. This reduced admission or admission assistance really helps them spend the whole day at the aquarium and really get that fantastic educational experience.
That's right. We really hope it helps. We know that coming to this area, the cost can add up very quickly. And so if this program is able to make that easier for people, then we're delighted. Museums for All is, of course, a national program, and federal food assistance benefits are all across the country. So people could come from anywhere across the U.S. and use this benefit.
Yeah, and that's interesting because we think of it as that people here close by would come to the aquarium just because it's, maybe if you're in Salinas, it's maybe a 30-minute drive, but it's nationwide and statewide. Anyone has the opportunity to come and enjoy this. And thank you, Kira. I hope you'll stay on while we turn to Annette Gallegos, who's going to talk a little bit more about the SNAP EBT benefits. And this is one benefit, but there is so much more.
Thank you so much. I'll stop my share and pass it over to Annette.
And yeah, Annette, have you had any client response to being able to come to the aquarium?
We are providing the flyers, as was mentioned, to all of our customers that come into our lobbies. We haven't had anyone indicate they're going to attend, but they take the information. I will just add that for CalFresh, like specifically that program, we do have approximately a little over 30,000 households receiving benefits in our county. So it is really throughout our county, not in any one region. So it is definitely a benefit for families. I think the only thing that I might maybe recommend is maybe actually giving the flyers to the schools if they have not actually already provided that, so that the students have it and their parents, they can give it to their parents if they want to go. I'm going to share a little bit, a brief PowerPoint with a little bit about CalFresh. So let me see. Are you able to see my PowerPoint?
Yes.
So let's see. So CalFresh, and also known as SNAP. So actually, that was actually a very good clarification. So SNAP and CalFresh are really throughout the state of California and other states, and it is for low-income households. So everyone that purchases and prepares their meals together, and it's really a supplement to help them purchase their food. And this is for anyone, whether they're working or not. There are some program rules regarding that. And when they are approved, they are given an EBT card. So what we ask for is really their name, their address, and they just have to sign the application. They do have to they have to be either a U.S. citizen or a qualifying non-citizen, and that would be anybody in their household. So if there is, there could be a parent or parents not eligible, but if their children are U.S. citizens or qualifying non-citizens, they could receive benefits for those individuals and still be within our income limits. So income limits, there is, I provided 2 websites that provide that, but I'm going to give you kind of a range. So if we had a person that of 1, the income limit is 2,430. And if you had a household of 2, it's 3,288. So how much could they receive? A household of 1 could receive up to 291. A household of 2, 535. EBT actually is issued to CalWORKs recipients and general assistance recipients as well. Most of those, if not, I'll say most of them, not all, but most are eligible to CalFresh. So ways that individuals can apply. So we say there's 5 ways. Do it online at benefitscal.com. They can call our customer service center. They can fax in an application if they download it from the state website, and that's the California Department of Social Services. They can mail an application to us or drop it off or come into our office, and we are open 8 a.m. to 5 p.m. So I did want to provide what it looks like. So this is the EBT card. So our SNAP EBT card looks like this. So there is another program that is actually running too, and it's called the Sunbucks. And actually it'll say Sunbucks on the bottom, and that is not CalFresh. So it does have to be an actual EBT card. And I also want to plug in for CalFresh just because we do see fraud that does happen. And so we do have an EBT, a mobile edge application that we really encourage all customers have so that they can actually manage their PIN number, ask for replacement. They can freeze their card so that way they don't have their benefits available until they actually go and use it. So it does help with any potential fraud. And then they could always call us, call the EBT line number if they need to report a lost or stolen EBT card. And I think that's the end of my presentation. Again, I just want to emphasize that we do have about a little over 30,000 households receiving those benefits. And I'm going to plug in one last thing, and that is that we did receive a grant, and we are working towards a mobile van that we hope that we will have the smaller one up and running by January of 2025, so that we can reach out to customers that have issues with either transportation and sometimes even just we're working with community-based organizations so that we can really get the trust from some different areas that may not normally come into our office. So,
Well, and that's a new way to get those flyers about Museums for All in the mobile,
yeah,
in the mobile unit too.
yes.
To the information that you just provided about who is receiving SNAP and EBT benefits, and what Kira was talking about wanting to make sure that there's no barrier for people to come and get, the information and the experience at a museum. Many people might wonder, well, why would some people get free admission somewhere? And when you look at the numbers for these recipients, these really are people who are at an income where every day really could be a struggle to determine, how much money do I have for rent? Can I afford a car? Do I have to take the bus? Can I go to the grocery store? I mean, these are really people who having that type of opportunity to go to a museum would be a fantastic event.
It would. I will say that I just had a meeting this week, and we were talking to the colleges and so students that are returning to school. And one story that was shared was actually a student who had very limited income and applied for CalFresh, really freeing up their money to really pay for potentially an apartment or a hotel because they were homeless but working. So just our area is so expensive, so that's a definite need and help.
Well, ladies, thank you so much for talking about the program. And we really hope for continued success with this. And we hope, Kira, we hope to see those numbers just stay really strong. And people, school is back in session now. So, families might take the opportunity on the weekend to come out. And also, I apologize, Kira, for not reading my own spell check. And I think I did a terrible thing to your last name and referred to you as a piece of bread. And so
It's a delicious sandwich and it happens all the time. So
I
no
know.
worries.
Well, that's what happens when you don't spell check your own writing, right?
No problem. We get it a lot.
Thank you. And thank you so much for sharing this information. I think it makes people feel really good that others who might not have the opportunity to go to the aquarium really get that chance. And it's just such a beautiful gem that we have in our own backyard, and to not have people be able to go, because of finances. It's just really nice to see that that barrier go away for those in need. Thank you again, ladies, for talking about this subject. I appreciate it.
My pleasure. We're so excited we can do this.
And now moving on to our next topic, it is very likely that someone in your circle of friends, someone you know, someone's life has been impacted by substance abuse. Overdose Awareness Day is this week. It's a time to remember lives lost, but also to find hope that there are millions of people in recovery. Dr. Christina Zaro is a specialist in family and addiction medicine at Natividad. She's here to share some information about the overdose issue. And also we're going to talk about an event that's coming up where we can all participate and be a part of the change. Dr. Zaro, thank you so much for being on the news briefing this week.
Yes, and thank you so much for having me. I have some slides I was going to share.
Please do.
Let's see. Can you see that?
Yes.
Right. So as you mentioned, I am a doctor at Natividad. I also work at the Laurel Family Practice Clinic through the county health department. And I run an addiction medicine clinic once a week, and also see a lot of patients that come through our hospital having had overdoses. And so this is a topic of very much interest and importance to me. And so let's see. I wanted to show everyone this graph of kind of where this is coming from. We have everyone knows we have an opioid overdose epidemic, and this has been going on for a long time, since the beginning of the 2000s, really. But we were seeing some control over it by about 2018, 2019. That was the low point of the rate of opioid-related overdose deaths, where we only had 8 in Monterey County that year. But now, as you can see, we have jumped again. And by the end of 2022, there were 31 deaths. And then now by the third quarter of 2023, we already had 47 deaths. And we don't have 2024 numbers yet, but they are continuing to go up as we look at them. And so why now are we increasing again? It really can be attributed to the presence of fentanyl in our drug supply. This is a map of our county, kind of showing where the darker shades are, where most of the overdose deaths are occurring. We see that it is in Southeast County, and then also right here in Salinas, East Salinas in particular, and then a little bit less so in the other parts of the county. And so what is fentanyl? Well, this is what fentanyl looks like to someone getting it on the streets. And in fact, it looks exactly like an authentic tablet called oxycodone. And it's formed by fentanyl producers and put right into the same form of tablet. And then the way it is generally used is it is crushed and then heated, and then the user would then snort it or inhale it to get more of a intense onset of a euphoric feeling. And then, unfortunately, another side effect of any opioid, if taken in a big enough dose, is respiratory depression, so death. And the problem with the illicit supply is that nobody ever knows what's in a tablet that is bought off the street. It could be all fentanyl, it could be half fentanyl, it could be mixed with something else like methamphetamine. So it's really, really highly risky to use these tablets. But unfortunately, a lot of people with opioid use disorder feel compelled to use them. And so what do we do about that? What are we doing? How are we addressing this? Short-term solution really is Narcan, Narcan, Narcan. Naloxone is the generic name for this medication. It is not a controlled substance. It is an opioid blocker, and it's meant to bump off all the opioids from the receptors in a person's brain just about immediately to cause them to start breathing again. And because we are using more and more fentanyl, seeing fentanyl in the system, which is much more highly potent than other opioids, we're finding that more Narcan is needed to reverse an overdose. And then this is a medication that used to be just in emergency rooms and ambulances. Now it is everywhere. It should be everywhere, and it should be accessible for everyone to have one in their medicine cabinet, in their car, hanging around their neck if they need it to save somebody's life. So secondarily, and also importantly, the other way we have to prevent these overdose deaths is a more long-term treatment approach for people with opioid use disorder. And I've listed here the medications that we have available: buprenorphine or Suboxone, methadone, naltrexone, and of course, always behavioral therapy that goes along with the medication. But the purpose of these medications is to reduce cravings that cause a person to return to opioid use, which is almost universal, that somebody with this problem will, once they've stopped, want to start using again. And so this is just a picture of Suboxone, which is buprenorphine, and how it is taken. Generally, it comes in a little strip form medication, and the good thing about buprenorphine is that it is a much safer opioid than any other opioid that one can take, because you cannot overdose on it. And it blocks all the receptors, so that if somebody were to use fentanyl on top of this buprenorphine, then the fentanyl would not have any effect. And the other nice thing about it is that it can be easily prescribed by any clinician with a DEA license. It's not like methadone, where you do have to go to a clinic and it has to be a special center for it. So we are fortunately seeing that more and more of our providers in Monterey County are prescribing buprenorphine. This just shows over the last 3 years how we went from almost no one prescribing it to now much increased rate of it. It means we're treating people with opioid use disorder, and we're preventing opioid overdose deaths. And so the reason we're having the briefing today is really to announce that it is Opioid Overdose Awareness Day, coming up on the 31st. At Natividad, we will be hosting an event on Friday, and this will be from noon to 1. We will be having guest speakers, Kathy England from the Sun Street Men's Residential Center to speak, and then as well, one of our ER doctors, Dr. Chris Burke, will talk about his experience with treating overdose due to opioids. And then finally, we will be hosting a table at the fair coming up this weekend. On Saturday, the Natividad will have a booth, so please visit from 12 to 5. We will be distributing Narcan, sponsored by the Monterey County Health Department. And that's all I have. Are there questions?
Dr. Zaro, thank you so much for really walking us so thoroughly through this. I think people know that there's an opioid epidemic, but they don't always know how significant it is in their own backyard. Sometimes you think it happens somewhere else. Sometimes you think it's in a big city. You don't have to be in a big city to be touched by this. You showed a slide, and this question was about that slide about deaths in Monterey County. And there were two targeted areas where there were more deaths, which was around Salinas and then in South County. Why do you think those areas are more impacted? The mortality rate is more severe in those areas.
Yeah, and my thought is access to resources. In South County, we do not have as many resources, as many clinics, doctors, clinicians, counselors, etc., who can address the patients who might have a problem with opioid use. Also, I'm thinking maybe access to Narcan is less, or perhaps less population, so that if somebody were to stop breathing from an overdose, there's less people around that could save them. And then in East Salinas, we have Chinatown, which is a concentration of folks who use substances and live on that street. And overdoses happen routinely. The kind of fortunate thing about that population is that they are a small community. They all do have Narcan. They are the ones that use Narcan on each other on pretty much a daily basis. So that would be my theory for why these two areas more have this problem more.
And another question, when you were talking about Narcan, and you were just talking about it, but earlier you were talking about Narcan. And you even described just kind of having it, it sounds like you're recommending everyone, no matter who you are, there's no harm in putting a box of Narcan in your purse or in your briefcase or in whatever you carry to have it around. It seems like we should all have one, just because there seems to be the possibility that we could use it anywhere.
Yes, and that is the recommendation now, that it is prescribed every time somebody is given a prescription for an opioid, even for a 3-day supply. It is Nalox boxes is kind of the latest, is sort of like a vending machine that's free, that's being put in our health department clinics, so that anybody can just open the little box and take one out. These distribution events. But yes, everyone, all of us should have it, put it in our first aid kits.
And then the last question was on the event. As part of the event, there's going to be a moment of silence. And that gives us all a chance to come together and acknowledge what is really, a community problem, of family and personal problem. But there's also good news. You were talking about the increase in prescriptions for the name of that drug that I can't say very well, that is a blocker. There seems to be, we're getting to the point where could we turn the corner on this with all these other resources? When could we turn the corner, in your opinion?
I think we could turn the corner as soon as we increase awareness of this problem, especially among the patients themselves and among
Attention, please.
Among the doctors and clinics and hospitals. We have an addiction care team that's fairly new for Natividad, but it's capturing all the people that come into our hospital having any kind of substance use. We go visit them and we give them resources. We were not doing that 2 years ago. So the more we can kind of get to these people when they're in the hospital, when they come see their doctors, when they're on the streets. We have We have a mobile clinic that goes out to Chinatown and offers Suboxone to people. Again, this is all new in the last few years. So I've got to think that the more we get out there, we will turn the corner.
Dr. Zara, thank you so much for your work in this area, and thank you for sharing about the event that is coming up. And for those that may not recall the date, it's the Overdose Awareness Day event is at Natividad on Friday the 30th from 12 to 1. A lot of information there, a lot of resources there, and that moment of silence where we can all come together. Thanks everyone for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.